Come in. Oh, hey. If it isn't my favorite patient, please make yourself comfortable. You know, when I saw your name on my schedule, well, it kinda made me excited. Don't mind if I sit a bit closer. I'm not wearing my glasses. So, let's get down to it. What brings you here today? To see me, I hope. Oh? Tell me more about this. So, you've come in because you're worried about a lump on your breast. Where exactly is it? How long have you noticed it was there for? A week. Okay. About the lump itself. Is it painful? It's not. Okay. If you press hard on it, does it feel smooth or bumpy? Smooth? You're not sure. Okay. Do you know if it's hard or soft? Don't worry if you can't answer exactly. It's my job to find out what's going on. Since you noticed it, has it changed at all? As in, gotten bigger? Smaller? Changed shape? You don't think so? Okay. Tell me. Did you recently get hit in the chest at all? You did? Was it by someone? Did someone hit you? No. You just bumped into a chair when you were bending over. Okay. And this lump appeared shortly after then. Right. I just want to ask you a few more questions. Have you noticed any discharge from your nipple? Any nipple inversion? Any redness or swelling in the breast? And lastly, any unintentional weight loss? None? Good. So, do you have any ideas of what it could be? Didn't think so. And is there anything you're particularly worried about? Cancer. I was expecting you would say that. Well, I have a pretty good idea of what it could be. But in order to confirm my suspicion, we'll have to perform a breast exam on you. But before we get on to that, let me just summarize what you've told me. So, you have a breast lump that you've noticed for about a week. It does not hurt. Has not changed since you noticed it. And you recently hit your chest on a chair. Good. As with all patients, I need to take a bit more of a history, particularly about you. Do you have any medical conditions at all? Like asthma or diabetes? People often forget to mention those. Are you on any medications at all? That's a good question to ask because some people tell you that they don't have any medical conditions, but then I find out that they're taking loads of medications for something. Anyway, do you have any allergies? Okay. Since you're worried about cancer, does it run in the family? Have any of your blood relatives been diagnosed with any kind of cancer? Now, a bit about your social life. Do you smoke? Drink much alcohol? Or take any other recreational drugs? I ask because all these increase the risk of cancer, particularly smoking. In fact, any medical condition you can name, smoking is a risk factor for. Okay, now, I would like to perform a breast examination. This will involve you undressing from the waist up, and me first inspecting the area. then placing my hands on your breast to assess the lump and try identifying any others. Then I will examine the glands in your neck and armpit. Does this sound okay? Excellent. First, I'll just draw the curtains. Then, wow, you got them out very quickly. Well, yes, of course I like them, why do you ask? But I take my job very seriously. You tease, you. It could get me into trouble. Okay, sit up with your legs hanging over the bed. No scars, no asymmetry, masses or swelling, nor any changes to the skin or nipple. Now, press your hands into your hips. This contracts your pectoralis muscles, which pushes any deeper lumps outwards. No visible changes. Now, put your hands behind your head and lean forward. Push your elbows back. Again, looks perfectly normal. Now, lie back on the bed, and we'll start with the normal breast. Put this arm behind your head. I'm sorry if my hands are cold, but they shouldn't be too cold. Okay, just having a feel. Let me know if this causes any pain, because it shouldn't. In the small circular motions. From the center outwards. No abnormal masses. Can you squeeze your nipple to see if any liquid comes out? Okay. Good. Now you can switch hands behind your head now. Okay. Again, in small circular motions. Yes, I can feel it. Is this the one you felt? Okay. It's a small mass. I'm impressed you picked this up. It's circular, smooth, quite hard. I'm going to pinch it now. It's solid, not fluid-filled. Let's have a feel for any others. No. Okay. Again, can you pinch your nipple? Good. Now, hold your arm out and go limp. Let me take its weight. I'm going to feel under your armpit for any swollen lymph nodes. Nope. All good. Okay, let's swap arms. Again, all clear. Now I'm going to stand behind you and have a feel for the nodes in your neck. Stop squirming. Ticklish, are we? Well, in that case. Tickle, tickle, tickle. I'm just kidding. Almost done, I promise. And I'm done. You may put your clothes back on. Good news. My suspicion was right. So I can confidently rule out cancer. What you have is something called fat necrosis. When you hit your chest, you damaged a bit of fat in your breast. That small area has died and turned into a scar. It's perfectly harmless, and don't worry, we don't need to do anything about it. It will go away on its own. Give it a month or two. But, since breast cancer is a common cause of anxiety among women, let me give you some advice. Tell you what to look out for. You can tell your friends or whatever. So, most are painless. So if you get a painless lump, not this one though, then see a doctor. Or me, obviously. Any visible changes to the breast, like swelling, redness, flaky or dry skin. Any nipple changes, like inversion or discharge. And another sign is if your breast looks like the skin of an orange. No, it won't be orange, but you know how the skin of oranges has little dimples in it? If your breast ever looks like that, then get seen. Also, any lumps in your armpit. And with any cancer, look out for any unintentional weight loss. And it goes without saying, if it's still there after a few months, or gets bigger, let me know. Okay? So, in terms of that, we're all done. Unless you want to stay a bit longer. You're my last patient before my lunch break, so that gives me some time. You do. That makes me happy. You know, you did not have to go through the whole trouble of making an appointment to see me. You have my number, don't you? Given the nature of the problem, you felt shy. Well, I hope you feel somewhat relieved now. You were expecting me to flirt like last time? I was not flirting. Well, maybe I was. Meh. But only because I am really attracted to you. And you knew that, didn't you? Yeah, I can see you grinning, trying to throw me off. You were surprised by my lack of flirting during the exam. Well, I'll have you know, I am an amazing doctor, as you can see. I take my job very seriously. But, seriously though, while it was fun flirting with you, I do actually like you, and I didn't want to be creepy while doing an intimate exam like that. What are you? Oh, this is you. You're drop calling me. So now I have your number. Is that right? You're shy and was too nervous to make the first move, since only you had my number. Well, true. I could have found your number and address on the system. But honestly, I'm not going to be a creep like that. I'm glad I earned your number like this. You know, even though I appear super confident and have what appears to be a massive ego, I don't, really. I mean, this is my clinic, and everything that goes on in here is exactly how I plan it. But the truth is, I only opened up to you because, I don't know, something about you makes me feel very secure, very comfortable. I really wasn't kidding when I said I haven't flirted with any other patients. Oh, really? Me sliding my number to you last time was smooth. Well, let's say I would have gotten into a lot of trouble if someone had found out. But I somehow knew you wouldn't grass on me. Maybe because of that smile you were hiding from me on your way out. Yes, there was a mirror on the door you probably didn't notice. Wow, you're going red. You're really cute, you know. Oh, you're going even redder. What does reception want? Yes. Seriously. And what have I done now? Why would I give him antibiotics if he doesn't have an infection? No. Thank you, Deborah, for the heads up. I owe you one. Oh, another complaint. Self-entitled patients. Everyone wants antibiotics and complains when I don't prescribe them any. Well, I've got some forms to fill out. Sorry. Where were we? You wouldn't complain about me, would you? About me making the other doctors look bad with my awesomeness. Right, I need to sort these out. Now that I've got your number, I guess you're gonna want me to text first. I'm just teasing you. You know, it was really nice seeing you today. You made my day. Especially that you requested Dr. Green to see you. So, I'll message you then, at some point today. I gotta see you soon. I want to know more about you. You know, first the basic stuff, etc., etc. Oh, bye. Gonna get a hug? Can't wait to see you. Oh, and one last thing. Remember, I know where you live. I'm sorry, that sounded a lot funnier in my head. Didn't realise it would be that creepy. Okay, sorry, I've messed this up. Looks like I'm gonna have to come up with a hell of a pickup line later then. Okay, bye. Stay safe. See you soon. At some point.